So let's talk about usability from a clinician's perspective. Carefx's Fusion FX product centers more or less around a portal that brings all the information from all the disparate departments into one location at the point of care. So the physician can have that at the moment that he's providing care. Physicians in the past, up until recently, have more or less pushed back on a lot of the healthcare IT that's being brought out into the industry. How well have your physicians embraced these portals, and how much do they like it?
So our physicians directly aren't using the portals that we have in place now. We're trying to talk with them more about, how would they use a portal for the future. And I think the work that we've done with Carefx in the past, be it on a vaccine system with the H1N1 and as well as the referral project that we put together, a lot of that has been for reporting, etc. The one portal that the physicians have used is the H1N1 tracking piece, and we've actually integrated that directly into the system. So no matter where they are in all three of our disparate applications, they're able to reach out and grab real-time vaccine data across an entire multiple different applications and even multiple different sites. So when they see that kind of interoperability, that's when they really start to embrace that idea.
So they're liking that?
Oh yeah, very much so.
You mentioned e-referral. Describe to us what exactly it is, how you were getting your referrals done before e-referral, what it was like to roll it out, and how it's improving healthcare now.
So the way we did referrals prior to this was every way you could possibly think of across the board. So there was really very little standardization and very little impetus to do standardization at all of the different clinical sites. So there were different ways to do referrals from my primary care as a primary care doctor within BMC, from the health centers that were around Boston Medical Center, and then from doctors that were outside of our direct network at Boston Medical Center. So they varied from phone calls to faxes to some people had emails set up. And then internally in each one of the specialty clinics at the hospital, there were multiple ways for them to make the appointment. So in some ways they would do tracking with paper, with Access databases, Excel spreadsheets. Some of them wouldn't do much tracking at all. And your chance of getting a referral made was at times quite low. It was very, very frustrating. We had even attempted to do some internal process improvement to try to increase the rate of our referrals that get made. And it was very, very difficult to do because you just couldn't get all the data in one place. So since we did the e-referral portal, layering it on top of a health information exchange, it allows, especially for the health centers into Boston Medical Center, a guarantee that this is going to be tracked, that you know when you make this referral that it's going to see its way through the entire way. So we see a big improvement in people's response to that because they like the idea that it's being tracked. So I think it's the e-referral process itself has been very well embraced as a standard. I think it has to be standardized in many ways just as a process workflow within more and more places throughout all of our different disparate areas. And people will embrace it more and more as we get kind of more and more functionality. So right now, I think it's even, it's very useful to clinicians, it's very useful to me as a physician, and it's also very useful to the front desk, the admin staff, and the people that are actively doing the coordination of that care and making sure the patient gets into their appointments. So I prefer, when I make a referral, that the patient has had the appointment before they leave the office, that I know where it is, that I can always go back and say, hey, I made a referral to that ophthalmologist, where is it? I will tell you that there are certain groups in, I think in every single place that every hospital that's around that has a lower rate of referrals being made, and we had some groups that were quite low, and I'd make how many referrals that were made, actually got an appointment, and the patient was seen, and to actually get feedback to the clinician that there's something going on, the person hasn't made it, there's some other barrier, is exactly, I think, what most clinicians have been waiting to have kind of data come back to them. So it's been very well received.